Which is the first step of the nursing process? The answer is C. Assessment. Which phase of the nursing process involves setting goals and expected outcomes? The answer is A. Planning. Which of the following is the normal adult pulse rate? The answer is B. 60 to 100 beats per minute. Normal respiratory rate in a healthy adult is? The answer is B. 12 to 20 breaths per minute. The normal oral body temperature is? The answer is B. 36.5 to 37.5 degrees Celsius. Which of the following is considered a normal blood pressure in adult? The answer is C. 120 over 80 mmHg. Which is the most effective method to prevent healthcare associated infections? The answer is C. Hand hygiene. Which blood group is known as the universal donor? The answer is D. O negative is the universal donor. Which blood group is the universal recipient? The answer is D. AB positive is the universal recipient. Which electrolyte is the major intracellular cation? The answer is B. Potassium is the major intracellular cation. Which route of drug administration provides the fastest onset of action? The answer is C. Intravenous provides the fastest onset of action. Which nursing position is most suitable for a patient with dyspnea? The answer is B. Fowler's position is the most suitable position for dyspnea. What does the abbreviation PRN mean? The answer is C. As needed. PR mean as needed. Which ethical principle means do no harm? The answer is C. Non-maleficence means do no harm. Which pulse is checked during CPR? The answer is B. Carotid pulse need to check during CPR. Which color bag is used for disposal of human anatomical waste in India? The answer is C. Yellow bag is used for anatomical waste in India. Which document is considered a legal record of nursing care? The answer is C. Nursing notes is considered as a legal record. The normal oxygen saturation in a healthy adult is? The answer is C. 95 to 100% is the healthy saturation in the adult. Which isolation precautions is required for a patient with pulmonary tuberculosis? The answer is C. Airborne precautions need to be taken in case of pulmonary tuberculosis. Before administering any medications, the nurse should first. The answer is A. Check the patient's identifier using two identifiers. The normal capillary refill time in an adult is? The answer is A. Less than 2 seconds is the normal capillary refill time in adult. Which vitamin is essential for blood clotting? The answer is D. Vitamin K is the essential for blood clotting. Which abbreviation means nothing by mouth? The answer is B. NPO means nothing by mouth. Which is the major extracellular cation? The answer is C. Sodium is the major extracellular cation. Which position is commonly used for rectal examination? The answer is C. Seems left lateral position is used for rectal examination. Which instruments used to measure the blood pressure? The answer is C. Sphygmomanometer is used to measure the blood pressure. Which route of medication administration bypasses the first pass metabolism? The answer is B. Intravenous. The normal urine output in an adult is approximately. The answer is B. 30 to 50 ml per hour. The ethical principle of respecting a patient's right to make decision is. The answer is C. Autonomy. Which pulse site is preferred in infants? Brachial site is most preferred in infants. Which of the following is a sterile procedure? The answer is C. Urinary catheterization. Which color biomedical waste bag is used for contaminated recyclable plastic waste? The answer is B. Red color bag is used for recyclable plastic waste. Which is the most common site for intradermal injection? The answer is C. Inner forearm is the most site for intradermal injection. Which of the following is a sign of hypoxia? The answer is A. Cyanosis we can see in case of hypoxia. Which solution is considered isotonic? Answer is C. 0.9% normal saline. Which action should be performed before and after every patient contact? The answer is B. Hand hygiene need to be performed after every patient contact. Which needle is commonly used for intramuscular injection in adult? The answer is B. 21 to 23 gauge needle should be used for intramuscular injection. The Glasgow Coma scale assesses B. Level of consciousness. Which of the following is included in the 5 rights of medication administration? The answer is A. Right patient. Which nursing action is the highest priority when a patient is unconscious? The answer is B. Ensure a patient airway in unconscious. Which artery is commonly used to measure the pulse in adult? The answer is B. Radial pulse. Which of the following is the normal pH of arterial blood? The answer is B. 7.35 to 7.45. Which electrolyte imbalance commonly causes cardiac arrhythmias? The answer is A. Hyperkalemia. The normal range of adult oxygen saturation. The answer is C. 95 to 100% is the normal oxygen saturation. Which of the following is a sign of dehydration? The answer is B. Dry mucous membrane seen in case of dehydration. Which route is most suitable for insulin administration? The answer is C. Subcutaneous. Which site is preferred for administering insulin? Most common site for insulin administration is answer A. Abdomen. Which of the following is a hypertonic solution? The answer is C. 3% normal saline is a hypertonic solution. What is the normal fasting blood glucose level? The answer is B. 70 to 99 mg per deciliter. Which is the most accurate method for confirming patient identify before a procedure? The answer is C. Using 2 patient identifiers. Which of the following is a droplet transmitted disease? The answer is C. Influenza is transmitted through droplets. The normal central venous pressure is approximately. The answer is B. 3 to 8 cm H2O. Which pulse site is used to assess circulation in an unconscious adult during CPR? The answer is C. Carotid pulse is used to assess pulse during CPR. Which of the following is a fat-soluble vitamin? The answer is vitamin K is a fat-soluble vitamin. Which nursing action helps prevent pressure ulcers? The answer is B. Reposition the patient every 2 hours. Which pulse is palpated before measuring blood pressure by the palpatory method? The answer is B. Radial arteries helps to measure blood pressure. Which of the following is a sign of hypoglycemia? The answer is B. Sweating and tremors can be seen in hypoglycemia. The best position for a patient after lumbar puncture is? The answer is B. Supine without a pillow. Which of the following is the strongest evidence of effective hand hygiene? The answer is B. Following the WHO hand hygiene technique at the appropriate moments. Which nursing intervention has the highest priority for a patient with severe respiratory distress? The answer is B. Maintain patent airway and administered oxygen as prescribed. The nurse is caring for a patient with epistaxis, nosebleed. What is the first nursing action? The answer is C. Sit the patient up and lean forward. Which of the following is the correct sequence of the nursing process? The answer is A. Assessment, diagnosis, planning, implementation, and evaluation. Which pulse is auscultated using a stethoscope? The answer is C. Apical pulse can hear by stethoscope. Which electrolyte is mainly responsible for a nerve impulse transmission and muscle contraction? The answer is C. Calcium. Which route is commonly used for tuberculin skin test or Montex test? The answer is B. Intradermal. Which position is best for a patient during administration of an enema? The answer is C. Left lateral position or Sims position is the best position for administering enema. Which microorganisms requires airborne precautions? The answer is B. Mycobacterium tuberculosis require airborne precautions. Which pulse site is preferred to assess circulation in an infant? The answer is C. Brachial is preferred to assess circulation in an infant. What is the recommended angle for intradermal injection? The answer is A. 15-degree angle is for intradermal injection. Which of the following is the antidote for opioid overdose? The answer is C. Naloxone